Today I am in my 5th week post-Ross procedure surgery that fixed my bicuspid aortic valve in my heart. My scar is right there to prove it. I already made a video about the first week and the challenges you face from that and what I faced. I kind of want to go over what it's been like following, what it feels like when you leave the hospital, when you go home, then what, and tell you a little bit about my experience and what I've been able to do so far, and some little things along the way. So, I already made a video about the first week, which I know I just mentioned, but I was in Jacksonville. I live about 4 hours from there, and that's where my surgery was done. I was discharged after a full week, and I had to stay in the area for about 2 days post. They want to make sure there weren't any complications directly after surgery, and before I, make sure I'm okay to travel, make sure that I can go home and, start my recovery. So initially leaving the hospital is really exciting because you just sat in a bed and, had every tube inside of you you could think would even be possible. And you get a little bit of independence back, but it's also really scary. Especially like the first time you're alone in the room. At least for me, my experience was during the surgery and the recovery process in the hospital. There's going to be someone a button away if anything were to go wrong. There's doctors right out the door that are going to come rushing in, and when you're just a few days away from that experience, it can be pretty daunting to be alone without that security. I stayed in a hotel for 2 days with my family. Didn't sleep too well the first day. Tried to walk as much as I could, and the time went by. It went by a little slow, but it went. I went to my checkup 2 days after being discharged, told me everything looks great, and sent me home. So we left right after that appointment. Drive home was fine. I was supposed to get out every hour to just prevent clotting and strokes and things like that you're going to be a higher risk for after open heart surgery. And then I got back to I was staying with my dad, so I was at my dad's house, and that's where I had been. So you get a little more comfortable as the days goes on. I have all sorts of gadgets to monitor my heart, my blood pressure, all that sort of stuff, which it's good to make sure that everything's okay, but I get a little obsessive with it. It's hard not to, being in a place where, the thing that is beating all the time is in jeopardy. My goal coming into this was to sharpen my mind as much as possible. I'm somebody who, previous to the surgery, would work out between running and physically lifting weights, like 5 to 7 days a week. At one point, I was running every day. And to go from that to a life where that is no longer possible is really difficult for people who manage their stress and kind of rely a lot of their mental, they put a lot of mental, you get a lot of emotional and mental release when you work hard at the gym or exercise, or if that's just part of your daily life. When that gets taken from you, it can be really hard to adjust. And I knew that going in. I had time to plan. So my goal was to read as many books as possible, meditate, journal, try and keep myself as busy as I could, because I didn't want to lay there and watch Netflix and waste away on my phone. And it worked it's worked fantastic. In the last month, I've read 10 books and have been really proud with my progress, but that is not to say there weren't a lot of challenges in transitioning that way. In my early second week of being home, I had a very emotional event happen. Something that really didn't help my healing process, and I was really upset by it. It was something I couldn't get over in that moment, and it made me spiral a little bit. And I fell into the mindset of poor me, didn't understand why this was happening, and all of those things. When previously, before that happened, that first week out of the hospital, I was doing fantastic. I was not fantastic, but I was really making strides. A few days after this event occurred, I went into AFib, which is a type of arrhythmia that's common for post-op open heart surgery patients. AFib is your heart just can't get the rhythm right. I was bouncing between like 60 beats per minute to 135, just oscillating back and forth. Earlier that day, I felt some weird palpitations, and then it kept happening throughout the day, and then ended up going to the hospital and got into AFib as I was there. I spent 3 days in the hospital again. They had me hooked up to a bunch of antiarrhythmic drugs to try and just let my heart reset. Those were another tough 3 days. Being back in the hospital, though, I will say provided a little bit of a safety net again. Because of that initial recovery, I did feel safe there, which was nice. So again, I tried to work through this mentally as best as I could, because I know anytime there's immense challenge is an opportunity to become far better than I've ever been. And I tried to keep that in mind as much as I could. I was meditating in the hospital, journaling, and reading. I was trying to get those things down. Those are new things for me to do also. That's not something I've done my whole life. That's just something that I wanted to hone. I wanted something to work on. After the third day of being on all these meds, and my heart wasn't going to flip back into regular rhythm, they told me I was going to get cardioverted. Cardioversion is where they do the defibrillators, and they go, like everyone's seen in every movie ever, in a hospital, they go clear, and then so that's what I was looking at. Honestly, the whole experience I had the first week in the hospital didn't make me very scared. It just kind of felt like the next challenge, the next thing I had to get over. They read to me all of the possibilities that could happen, and it's like it might not go back into rhythm, might have to get shocked twice, heart might stop, and that was that. Nothing I can do about it. So I got transferred down to the ICU. They gave me some sedatives, and off they went. This one, I didn't feel anything. They gave me the sedatives. Basically felt like I went to sleep for 10 minutes. I did feel my body come off the bed, but other than that, it was good. My heart went back into rhythm, and they sent me home. About 4 days later, I went back into AFib. I knew it immediately. It was actually atrial flutter, which is like a pretty close with AFib. My heart rate was just sustained at like 135. There was nothing getting it down. It was just stuck there. And it was all very erratic as well. It wasn't like just fast beating. It was like 1, 2, 3, 4, 5, 1, 2, 3, 4. So it would like, the average was around 135. So I knew right away. I had my dad drive me to the hospital. Went to the ER. They hooked me up again, but this time because my cardiologist from the last visit already knew that the antiarrhythmic drugs didn't work, so they wanted to cardiovert me again. So after they made sure I wasn't having a pulmonary embolism or a clot anywhere, they went and set up for that. This time they sedated me, but they did the sedation with one less drug, and I closed my eyes, kind of went back into almost a dazed sleep. And this time when they did the actual electrical pulse, I felt everything. I screamed so loud the whole ER heard. My body came like 6 inches off the bed, and then I kind of passed back out after. It felt like what I would imagine someone putting a grenade or some sort of explosive like inside of your chest and it exploding is the best way I know how to put that. Now, this is generally speaking, like the first time I did this, I was completely fine. This isn't something that most people really have to worry about. I have a feeling I was getting used to the sedatives because they used it last time and just wasn't quite enough. And just didn't quite go all the way. So again, I was back in rhythm and they sent me home. My body took quite the toll after both fits of AFib. All the progress I feel like I made in the first week felt like it was gone. I just felt weaker, short of breath, just having a really tough time getting around. It felt kind of like it did, when I was in the hospital, like walking around. But I wanted to keep that mindset that it's just another opportunity for me to get better and for me to get mentally stronger, physically work on these things that I would never have time otherwise to work on because I have all day. And that's been a profound change in my life because of this experience. And it's led me to a really great place, even though I'm still struggling mightily. Physically, I know where I'm gonna be and we're heading in the right spot. So fast forward, another 2 weeks, I was walking and I have my to-do list, I have my day planned out because with this much time on your hands during recovery, your mind is your worst enemy. You start to think, you can feel every heartbeat, you can sit there and just think about all the things that can go wrong. And if you harp on it and think about it the whole time, something's bound to go wrong. So it's keeping that positive attitude as much as you can. But I've kept myself as busy as possible, and it's led me to some really profound realizations. So I am today at week 5. I am starting to up the amount I walk. I've been very, very lightly jogging just to see if I could. Testing the waters with that, see how my body reacts the next day, and then kind of, trial and error. My cardiologist told me I can get my heart rate up to 120-ish, 130, and it's okay as long as it's not sustained. So it's kind of what I've been touching and making sure I don't go any higher, managing my blood pressure every day. But I have such a desire to get better and get past this and use every single challenge that is a part of a situation like this, because otherwise, what's the point? What's the point of getting through all of this if I'm not going to be stronger and I can't learn from it? So, with that being said, my advice for anyone that might be about to go into a major surgery, whether it's open heart surgery or something with a long recovery, is plan for when you get home. Try and work on some things that you can do while you're recovering, while you have all this time. Reflect on your life, reflect on who you want to be, and try and work that out. The time that you're going to have is so valuable. You don't have to worry about work. You don't have to, or I at least, I'm sure some people have to worry about work. I'm fortunate enough that I have, I'm on medical leave and I can take this time. But having all of this time has been the most valuable thing possible. So use it wisely, because as soon as you're done recovering, you're gonna go right back to, what life was before. So try and, read, cook, do a new skill, whatever you can do while you're recovering, is going to keep your busy and your mind healthy. And the most important aspect of this recovery is keeping your mind as healthy as possible. So, yeah, I hope this helps. Again, I didn't sugarcoat anything. I just am sharing my experience. I don't want to scare anybody to think that they're gonna have complications. It's just something that happened to me. And even though it happened, we're still getting better, and I'm still gonna get to where I want to be. So, yeah. So thank you. If anyone ever feels like they need help preparing or getting through something like this, please reach out to me, reach out to your family, your doctors, your therapist, anybody, because this is not something life can really prepare you for. This is just something that you get thrown into, and it takes a lot to get through. So I'm here for you, your family's here for you, people that love you are here for you. Though they might not understand, they still want to help. So